Welcome to the TaAF Talks podcast, the show that is all about influencing positive change and doing things differently. My name is Jamie Waugh from Together an Active Future. And with me, virtually, although I still love him literally, it's the irreplaceable, dynamic, and what can I go with? My brother in arms, the man I love, Ken Massey. How you doing, mate?
I'm very well, thank you. It's good to be here on a beautiful Friday morning, although I'm stuck in my loft upstairs, so hopefully going to see the sun a little bit later on. Okay, so today, when we've been thinking a lot about GPs, and when we need to talk about physical or mental health or general well-being, first up, I think for most people is our GP. And as part of the Together an Active Future project, the role of the GP in the practice is really important as we think about those people who can influence physical activity and well-being in a place. And so, Jamie, on today's podcast, we're going to have a chat with possibly the most enthusiastic and talented GP certainly in Rossendale, definitely in Pennine, Lancashire, and probably in the whole of the UK, Dr Emma Gladwinfield of St James's Medical Practice in Rossendale. So, Emma, welcome.
Wow, I absolutely love that intro. Can I put it on my TV?
I mean, that is up there. That is up there. No pressure. Just
I know, goodness me.
All over the country. Awesome. We're absolutely chuffed to bits to have you, Emma. Thank you so much for joining
me. Yeah, thank you for asking me.
There's always that bit of me and Ken love to talk about certain things, but what we actually need generally is somebody who actually knows what they're talking about in some of these categories. And so that's really helpful that you're here with us. So, Emma, the first thing that we always like to do, which is to try and make this a positive experience for people. And sometimes we even manage that. So what I'd like to do is firstly just ask you, for you, what would be a positive experience from today's podcast? What are your success factors for today?
Well, I'd like to have a bit of fun because at the moment it's a little bit depressing, isn't it, with this coronavirus? So have some fun. I want to get a message out about improving people's well-being and hopefully maybe influence some other healthcare professionals to be proactive and reach out to the community, because the communities are really receptive and they want to improve their well-being.
Fabulous. So Ken has captured them. What we like to do is at the end, we'll return to them and see if we've managed to collectively deliver on our success factors. Just on one, Ken's writing as quickly as he can, bless him, with his finger on the pad. I think that's a really interesting point of one of the ones you just made there, which is perhaps now more than ever, people are really receptive to some advice and some positive messaging and what we can all do to kind of improve ourselves in these times. So I think that's a beautiful one to have. Right, perfect. So, we'll return to them. I thought, if we could just start, Emma, if it's okay for you to just, in a real kind of 30 seconds or so, if that's not too kind of short for you, just talk a little about you, your role and your passions in that role, maybe.
Right, well, I have graduated from Cardiff Medical School in 2005. Then I did hospital medicine for a bit and then went into GP training. And I've been a GP since 2011. I was working in Hebden Bridge as a GP partner there. And then in 2018, I came over to Rossendale. That's where I live. And I've been working at St James's Medical Practice there. I'm also a GP trainer. And so that means that I'm training doctors to become GPs, fully fledged GPs. I also help with UCLan Medical School as well, with the medical students. I suppose my passions are about just general well-being, not always going towards the pills, sort of promoting healthy lifestyle, preventative medicine, so patients don't actually come to see me. We get them before they start with any illnesses. Got to mention my 3 children, and they're definitely a passion of mine. And I've got a small holding, and we're currently lambing at the moment.
So and how many days are in your week? Because I only have 7. It sounds like you have about 20 basis to what you said.
You know, it's hard work, but I don't watch any TV, you see. So and I go outside an awful lot. That's my de-stress.
Amazing. Wow. And just whilst we're on, is there a place that people can go and find out more about you or see the kind of things that you're talking about? So are you a presence on Twitter or Facebook or anything like that?
Yes, so I'm on Twitter. It's at Dr Emma G. I also run a group on Facebook called Rossendale Mums Matter. And before coronavirus, we were having regular sort of meetups talking about mum's well-being. So people can join that on Facebook. I also partly run a group called Not Another Baby Group. And
which is what Ken and his wife said once they got up to number 4 or 5, I imagine.
Yeah. So Not Another Baby Group is all about the mum's well-being. There's a lot of focus at the baby groups about the baby and it being interactive, and it's all focuses about the baby, but this one is about the parents. So the babies, they come, there's toys there, but it's all about the conversations that we have, and we have a topic every week. So there's that as well. People can get in touch with me via that.
Fabulous. So I encourage you all to do that. And I love your Twitter handle. It sounds super gangster. What was it? At Emma G. What was it again?
Dr. Emma G.
Dr. Emma G. Real gangster. Love it. Okay, fab. So thank you for that. A nice introduction and some fab stuff that people can find you on. So what we'd like to start with, if it's okay, just for this little first portion of the podcast, and talk a little bit about the reality of what's currently going on. Obviously, we're currently in the midst of coronavirus. So what we wanted to just understand a little bit is the reality for a GP and their practice staff during this time. And maybe just start us off with maybe what's some of the biggest changes that you and your teams have had to manage since this has started?
So I suppose the biggest thing for us was that we used to do mainly face-to-face appointments, and our practice was open for patients to come in, see GPs, see the nurses, sort of speak to reception staff, but our doors are closed now, and we're speaking to people mainly through telephone triage, video consultations. With the patients that we are, that we want to see face-to-face, they're coming in on their own mainly. Normally we'd be saying, you can bring a family member or something like that, but now we're saying just stick to it yourself, come in, and we've got special rooms where we examine patients now, which have to be thoroughly cleaned after we've seen a patient. So there's been a real sort of change in focus in the way that we're doing consultations, which is challenging when you're used to seeing patients sat next to you and, picking up on non-verbal cues and things like that, to be able to take a good, accurate history over the phone and feel confident that you're doing the right thing for the patient. There's also for our staff and the GPs and the nurses, there's that element of fear now. We will be exposed to people with coronavirus, and we're noticing that the mortality is going up, and it's scary times. We're wondering about our PPE. Is it good enough? So things have considerably changed. And as a GP trainer, I feel for my trainee at the moment, bless his cotton socks. I mean, he doesn't know what's going to happen to his training. He doesn't know if he will be qualifying in August as a GP, or if it's going to be extended, because he's not having the clinical exposure that he was, having before coronavirus. But, everybody's doing so well. I'm so proud of, the NHS, the medical profession. We're so adaptable, resilient, we're getting on with it. And, patient care is still paramount.
I think what's been really good in Rossendale, certainly, from what I've seen, it is just that last point there, the kind of way that GPs have adapted and collaborating and working together. And one of the, we're having a chat yesterday with some GPs and community groups. I mean, one of the things that I suppose is challenging, and I'd welcome your view on it, is this sense that actually potentially a lot of people who've got some significant medical concerns are actually now not communicating with their GP and others. I mean, is that something that's kind of real life in your experience?
It is. It's really quite scary, Ken, because it has been quiet, and we don't like to use that word in the medical profession. This week, things have got a little bit busier, but compared to normal, we're not having, the really unwell adults, the really unwell children don't seem to be presenting. What is that about? Is it to do with they don't want to bother us because they think we're inundated with coronavirus? Is it they're scared? Is it part of the fact that, everybody's at home, they're not mixing with other people, so infection rates are just lower anyway? But the thing about the cancer referrals is that it has really dropped significantly. It's about 10% of what GPs were referring before coronavirus. And that is scary. So we know that once this pandemic's over with, we're going to have an awful lot to deal with. Late presentation of illness, people who, have got possibly more advanced cancer than they should have if they'd have presented earlier. All the mental health issues that are going to come from this, social deprivation, money issues. So we're talking about the coronavirus pandemic, but it's going to have absolute ripple effects for years and years afterwards.
There's an interesting thing with that, which is it's easy to fall into the kind of shtick a little bit of, this is going to show everybody there's a new way of doing consultations. We've always been wanting to encourage more kind of non-presenting, do it over the phone, do it by Skype.
Yeah.
And from a cold, hard kind of business point of view of trying to reduce demand on practices, that it's easy to just go, of course, and this will probably show us we can do more of that.
Yes.
But actually the flip side of that is, but you don't want to change this culture of don't bother your GP. Don't put a burden on them because they're really, really busy.
Yeah.
Because in reality, as you say, what we're actually seeing, which is the opposite of what you want, in reality, you would like to potentially reduce the amount of people who turn up with really minor stuff that could be managed elsewhere.
That's it,
You never want the people who think there might be something to drop off. They're the ones we want. I don't want to say more of them.
Yes.
But in reality, that's what we want people going to the practices for, isn't it?
Yes, absolutely. So I think, there is this scope that we can, GPs and healthcare professionals, we can make the most of this and sort of develop, some sort of education, put our messages across about how to manage simple illnesses. And that's something that we do with the Mums Matter group. So, I go in and talk about how to manage simple childhood illnesses at home, when you need to be concerned and when you need to see a GP. So I think we need to get the message out, but definitely to push things about, when you do need to see your GP and your GP isn't too busy at all. We're here for, the really unwell people. We're also, if we know that some people, they want to speak to us for reassurance because once they've just spoke to us, their anxiety levels reduce. We have to think about mental health as well. People with depression, they often feel like, I don't want to trouble my GP because there's people who are worse off, people who've got cancer, but we can help these people. So, those people definitely need to give us a ring.
And I think I'm going to chuck in one personal experience I've got of that, which is, I'm the kind of person who rarely goes to a GP, unless it feels fundamental, like something, oh my goodness, this just dropped off, what do I do about this? But I think there was a particular time where I was just going through some things mentally, struggling. And literally, you wouldn't have known it. And had you seen me in that GP practice waiting room, you might have been like, this is one of those people who turn up with not anything really wrong with them. But all it took was 1 10-minute conversation. Gave me reassurance, gave me some advice.
Yeah. And
that was enough then to sort me out for the next 2-3 weeks as I started kind of improving out of that.
Yes.
Now, that might have felt to others like it's a waste of time, actually. There's people much more sick. But actually, catching that early, having that reassuring conversation means I'm not coming back in 4 weeks' time in a much worse way.
Yeah.
Or worse, or whatever it would be.
I always say to my trainees that we need to see ourselves, the doctors are a medicine as well. Effective consultation skills, we have got the knowledge, we're, reassuring, we are a type of medicine and we need to value ourselves for that as well.
I've never heard that kind of term. It's quite nice, isn't it? Doctors are a medicine as well.
I love that. I think we talked about quite a few things there in terms of the way in which GP practices are starting just to change, and that the role of the GP is potentially going to maybe slightly mould and adjust and change for us moving forwards. And there's that sense of, I don't think video consultations and phone consultations are going to finish anytime soon, sadly. I wish that they would, but I think we'll be around for a long time.
Yes.
And also that sense of, the role of GPs changing towards being and perhaps more community focused, more focused on, you mentioned about education, and that sense of helping people to understand, when do I need a GP, when do I don't, how do I manage my own health better. And I think one of the things that we can perhaps just move on to, if we can, the Together an Active Future project is really about this sense of trying to increase people's sense of well-being and levels of physical activity. What do you think moving forward, the role of GPs could be or potentially should be in terms of that real focus on developing people's health as well as dealing with people's illness?
Yeah, I mean, in medical school, we were told that preventative medicine, it is the best medicine. But unfortunately, during training, it seems to be more focused on disease and picking up disease and treating it. So I think we need to sort of go back to the books almost and try and reach the people who haven't got the illnesses, who are at risk to develop it, and be more proactive and get out into the community. Either we do that through lots of GP practices together, organising education events for different types of patients, or we just set up groups. But I think we need to have more of a focus on well-being, on movement, on mental health, on improving your diet. And that the fact is, if you do these things, even if you have a condition, you're going to feel tons better if you start looking after yourself really well. But if you don't have a condition, the chances are you're going to prevent getting, COPD, so chest problems, certain cancers, heart problems, mental health issues. So there needs to be a focus about lifestyle medicine.
Is it fair to say, so I'm going to do one of those things now, which is not right, when I ask you to speak on behalf of, a nation of GP, but coming back to that point with regards to the training, is it fair to say that even now, the training is still pretty much, the things that we talk about are absolutely, it's preventative, it's public health, it's all that kind of stuff. But then is the training still quite disease specific and focused?
It is, because, Jamie, if you can imagine like GP training, we have to know about, basically cradle to grave medicine. Yeah. It is a massive amount of information. And I can completely understand with trainees. So they focus on the diseases because they don't want to not pick up a thyroid cancer, or they don't want to pick up someone who's got an MI and they've just dismissed it. So the way that they train, they are sort of very focused on the diseases. So every part of the curriculum, we do talk about lifestyle measures to reduce it, and that is the management for lots of different conditions. But I think the focus, once people have graduated from GPs tend to start thinking to themselves, getting a bit, not fed up, but I want to do something more proactive. I'm giving people all these medicines for the diabetes and they just keep coming back. Maybe we need to start looking at lifestyle and, reducing the medicine, seeing how we can help them, empower them, exercise more, improve the diet, that sort of thing. So I think as a trainee, rightly or wrongly, they're very focused on the diseases because there's so many of them. But then GPs, we do get more information about preventative medicine. There's lots of courses going on now for GPs and GP trainees, all about lifestyle medicine. I've been on a fair few of them, and they're absolutely brilliant because you meet up with like-minded GPs who don't want to be giving pills all the time, going back to basics.
And I think we might even touch on one of those in the next little section when we talk about physical activity. And I think that it does pose that interesting question of should it be for a GP to also be looking after the wellbeing, because like you say, it's the training does an awful lot, and you can understand absolutely why it focuses on illnesses and diseases, because if you're not catching them, that's catastrophic in people's lives. And it's, and other than extending the training to be another year or two to add in. So there is a little bit of, and it's not something we'll solve now, is some of it might be reliant on certain GPs having a passion in wanting to do some of the earlier stuff. Yeah. But some of it might also be up to some of those parts around the GP practices and the other teams and the leisure trusts and things to be saying,
social prescribing.
Well, we've got a big role here to help them, because in reality, some of us might have a bit more knowledge of what's going on, which is a helpful thing to have that a GP could never possibly have enough of. And we might also have some more time that GPs tend to not have necessarily in their rather short windows of appointments. So I think there's an interesting balance of helping GPs evolve by, as you say, the conferences and the training that they can have, that they can do, and actually increasing the awareness of some of them, because maybe GPs don't know about some of that great stuff because it's not communicated great. But not forgetting that actually there's an awful lot that can happen around there. And are we offering the help that we could as a system to the reception staff? Are we offering the help that we could to placing what people might call link workers or whatever in GP practices or linked to them? And I think all these things are happening more and more.
Yeah, it's really amazing how these changes are happening. So now we've got a social prescriber in our practice every Tuesday morning, and he's just brilliant, looking at patients holistically, linking them up to different things at the leisure trust, groups around Rossendale. And this is what we need to focus about, because loneliness now, we know that reduces people's lifespan, and loneliness is almost a pandemic, isn't it? It's just spreading and spreading, and that causes problems with mental health, disconnection. So we need to get these people more engaged with things. So, but when you were saying about, is it the GP's role to do wellbeing? Personally, I do think that it is, because as GPs, we should be treating the patient holistically. And, when they come in, we don't say, oh, that's a diabetic. We need to say, oh, well, this is Mr. Smith who lives with Mrs. Smith. And we know that, and look at the whole picture of Mr. Smith and see how we can help him.
And I think just to, I suppose, just to build on that point and sort of wrap that into a bit of a conclusion, that little element, there's, I think not only is it the GP's role to start thinking in that holistic way about the patients, but also to connect into the communities. But communities need to really start to not only connect together, but also connect with their GPs and draw them out of the practice, as well as supporting them in the practice to get a real sense of people working together on the same issues. And we've seen some little bits of success in that in Pennine, Lancashire, and I know we work together in Rossendale a little bit, and they're just the startings of, we used to have community stuff and we used to have medical stuff, but those are starting to become connected and into the same areas and the same sorts of things.
Yeah, and that's brilliant, isn't it? I just want us to sort of develop it so that we have community stuff, medical stuff, and then we get the schools involved. And I just think that would be perfect. If we get education involved, I think we would have things sorted.
Well, I think one tiny point I'd like to make there is if you looked at the amount of people out there who were there to support people with an army, you've probably got as many people as you'd ever possibly need.
Yeah.
The bit not quite cracked, and it's always evolving, is the working collectively with a group of people and actually doing that. As we improve doing that, maybe some of the things that sometimes feel like sticking places, if we need more people, we don't need more people. We just need a better relationship with some of ourselves to be able to connect it a bit better.
Absolutely, yeah.
Okay. That's been really good first off, and I'm going to jump in because one of my favourite bits of the podcast is doing our Pennine quickfire questions, Emma.
Right.
And this is where we're going to quiz you on some things so people get to know you a bit better, and we can also have a little bit of fun together. So the way that this works is we're going to start a ticking timer to put you under a bit more pressure.
Right.
and then ask you some questions about you, and you just have to say the first thing that comes into your head, really.
Okay.
And if we find that there's something fantastically interesting or amusing or enjoyable, we get the privilege of stopping the timer and quizzing you about it a bit more, but you just have to keep going.
Right. So
happy with that, Jamie?
Okay.
Happy with that?
Yes, pal. So you happy to do the timer and do the questions on your side?
Yeah, I think so. I'm just seeing. Let's see if we can get this timer to work. Let me know if you can hear that.
Yeah.
Okay, Emma, here we go. So, what is your nickname?
Pugskin.
Oh, stop the timer immediately. So you have to explain that to us.
Well, I mean, that's from my husband because I absolutely love pugs. I used to have one, Percy, and so I don't know. He's called Ratskin.
Because did you say rat? Does he love rats?
No, but just I don't. You know how things are when you're in a couple.
Yeah, we don't need to delve into your life as a couple together. Pugskin, okay.
Yeah, let's move it and leave it and move on. Okay, next one. What's your favourite movie ever?
Oh, Dirty Dancing.
Nice. One thing that annoys you.
Ignorant people.
And one thing that excites you.
Domino's Pizza.
Which I'm gonna stop and ask you, which is your Domino's pizza of choice?
Vegetarian Supreme.
Nice. Are you vegetarian?
No.
No, but that's the one you like. Good for you.
Yeah, we're having that tonight. That's why Domino's is on my head. You see.
It's in your mind.
When I finally get through this ridiculous podcast, I'm having a pizza.
Good.
Okay, we've still got a few more left. How long does it take you to get ready?
5 minutes.
Describe yourself in 3 words.
Happy.
You can leave it there if you want. It's a good one.
Happy, kind, and determined.
Nice.
Very good. Qualifications, experience, or personality?
What do I think is more important?
Yeah.
Is that?
Yeah.
Personality.
Good decision. I agree.
Yeah.
I always do because I have no qualifications.
You wanted me to tell you my qualification.
No. I'm sure you've got lots. We'll feel bad.
Yeah.
Number 8. If there's a spider in your house, do you kill it or set it free?
Set it free.
And if you had one superpower, what would it be?
To fly.
To fly. Someone else picked to fly recently.
It would make things much quicker.
It certainly would.
Would it not be easy to teleport?
I'll fly right over would be literal.
Yeah.
It would make home visits easy, wouldn't it?
Absolutely, yeah.
Okay, and the last question, number 10. This is the most important question of all. And the question is, Jamie or Ken?
Well, it would have to be Ken.
Yes. Well, everyone picks me, Emma, so don't worry.
I'm trying to let everybody know everybody picks him to get some pity votes, and it never works.
Oh, well, it's just that I've known Ken longer. I've got more loyalty.
You do not need to explain yourself. Ken is a smasher of a bloke. I agree with you.
Who like you, Jamie?
Thanks. It felt a bit of an afterthought, but thanks.
Yeah. No,
They were really good ones, Em. I really enjoyed that a lot. So, okay, as always now, from the madness of that into kind of carrying on a bit of a next topic. So I think we talked about the roles of GPs and practices with regards to looking after people's well-being. I think just to do a kind of tiny little bit extra on that before we move into something more specific, what do you think is the biggest challenge for you and your staff with regards to that well-being approach?
I think it's time, because we only have 10 minutes per patient, and in that time we have to, see them, get a rapport going, find out what the problem is, then find out what the real problem is, and then address, lifestyle and make sure that the patient leaves safe with, the correct treatments or whatever it is. So and write the notes as well. So I really do think that it's time, and we need to have more emphasis on perhaps having longer consultations so that we're able to do the preventative medicine side. I think there's lots of sort of literature about GP consultations, and I think there is one of them that talks about every GP consultation has the potential to change a patient's, to develop something for preventative medicine for the patient. And unfortunately, I think that aspect is neglected in a lot of GP consultations because we just don't have the time for it. So that's why it's important that I think after all this coronavirus, we sort of get outside of our practices or do things online, engage patients about, lifestyle medicine, really.
I think if you think about 10 minutes, I mean, it takes us 10 minutes to get past the introduction for a podcast, you know what I mean? And that's the time that you've got to really look after somebody who might be there with something really kind of quite serious going on for them.
Yes.
Crazy thought, really.
I know it is, but we're highly skilled that we can sort of do that. And often I'm running late, as my patients will tell you.
So Ken, I'm gonna have to do something super unprofessional now. My laptop's not plugged in. My battery's about to go. So I'm going to leave you with leading the next question. I'm going to leg it away, and then in 10 seconds I'll be back.
Okay, no problem. So the next bit we wanted to talk about was really around, what might the future look like in terms of, what things we've touched on a couple in terms of perhaps education events or others, but what practical kind of things do we think that GPs could do? If we take a few minutes to think about, other health professionals, what are some of the things that we could do differently after coronavirus? Mm-hmm. To be more in this space of sort of community wellbeing and lifestyle medicine? What are some of the kind of practical, apart from trying to figure out longer appointments, what are some of the other practical things we might be able to do in that area? And I've got some initial thoughts for me, I suppose. I think one of the things that you've done really brilliantly with your Mums Matter group is sort of hosting workshops and other things that can help people to connect with their GP in a different setting and connect together and discuss key topics. I know you and I have been working on a wellbeing weekend. All community groups and doctors and GPs and health professionals together to look at, how do we create events and spaces for people to discuss wellbeing and lifestyle medicine? But what are some of the other practical things that health professionals might be able to do in the future to change the way it looks now?
I think we need to sort of engage with patients more via social media, with Facebook pages, so that we get our message across to people that way. And that's quite an effective way of, reaching our patients. Or, Facebook lives, Zoom meetings. I saw on Twitter the other day that a GP was hosting a diabetes low carb chat via Zoom. So, I think we need to think in different ways about the way that we consult. There's also group consultations that may be started, and they're quite useful for people with the same condition, because then you get the sort of peer support. So we know that group consultations are successful for people with diabetes, type 2 diabetes, COPD, so that's chronic obstructive pulmonary disease, some types of childhood illnesses. So, one GP would go in, talk to them about the condition, see how they're all doing, and then have a bit of time to sort of say about holistically how they can improve the health. So just using our time more cleverly.
I think there's also something for me in the group side of things is it also potentially removes some of that either personal stigma or aloneness that that's not the word, but that you might be feeling about having that condition.
Yeah.
It is that thing of the second you're in a room with 6 people and somebody asks the question that you think, oh, I'm glad you asked that question, because that's the question that I had and I was too scared to. It just gets past this. Everything needs to be confidential. Everything needs to be treated in a one-to-one setting. And actually, the people can do stuff for themselves, you know, and I think that, like you said, that peer support bit also supports some of that mental well-being challenge of having a physical condition potentially.
Yes, yeah, the connection. When we were doing the Mums Matter groups and things, one time we had a really amazing practice nurse, Rachel Elvin. She came in and she talked about smears, and we had a room, there was about 40 women there. And afterwards, so many women came saying, you know what, that presentation was amazing. I'm not scared about my smear now. I'm going to book it. And, you know, it's sort of getting the message out there, making it more, well, knowledge is power, isn't it? I think for a lot of these ladies, they didn't quite know what was going on, what we were looking for with a smear, but to inform our patients more about it. Same with vaccinations and things. So working in a different way, I think. And, you know, as we've said, getting groups of patients together to, you know, community, peer support, that's just going to help.
And like I say, I think right now, maybe patients are getting their first proper experiences of Zoom calls with multiple friends, and GPs might be doing it as professionals. So maybe it's a bit less weird in a few months' time when we start coming back to normal for everyone to go, so I know what a video call is, I know how to do it, I've got an account already.
Yes.
It removes some of those kind of barriers a little bit, doesn't it?
Yeah, because we've been pushed into this, really. Yeah. So, you know, we should make the most of these new skills that we've learned during this.
Fab. So, if it's okay, Ken, are you cool for us to move it into a little bit more of the physical activity?
Yeah, I think that's probably the last bit that was really interesting to discuss. You know, Together in Active Futures, that sense of there is a holistic approach, and this recognition that there's loads of factors that impact on people's lives. But with it being Sport England funded, there's obviously an element of focus on the physical activity and the movement side. You know, it'd be interesting to just chat a bit about that. And I know you, Jamie, have got potentially something to share on that in terms of resources and things, perhaps.
Yeah, I think if it's okay, Emma, I think is if you can offer your own kind of personal experience, if you have some of perhaps how patients respond to maybe a conversation about being more active, because I imagine there's a little bit of unease from various professionals about having that type of chat. And just maybe experiences of how patients respond to that, and maybe some examples you've got of how it's worked for them.
Yeah, so, I mean, I can think of so many examples of patients that I've spoke to them about increasing the physical activity, because, you know, it just makes you feel so much better, doesn't it? It doesn't have to be, you know, hard cardio or, you know, hitting the swimming pool at 6 o'clock in the morning. You know, just getting out there, having a bit of a walk, just, you know, improves people's health generally. So with people who've got depression, sometimes it's difficult for, well, they have very low motivation with depression, that's a symptom. But trying to encourage them and giving them the evidence that, you know, if you take that first step out the door and go for a run, or, you know, go for a walk or a swim, that's the hardest step. But we know that the natural endorphins will come and you'll start feeling better. And then it's about getting a habit. So I find with patients, sometimes they can switch off when you say, you know, you should, you know, eat less and move more. They've heard that hundreds, thousands of times. But if you relate it to their problem and you give them some evidence of why you think for them it's going to work, they're more likely to take it on. And, you know, I've had amazing success with people who've had, you know, depression, anxiety, not necessarily going on any tablets, but, you know, they've been going to the gym outside in our lovely Rossendale countryside, and, you know, their anxiety and the depression symptoms are getting better, and it's because of, you know, physical activity. And then with that, they're eating a little bit better, more fibre, and we know that has a massive effect on inflammation in the brain. So generally, I think patients are welcoming the information, but you've got to make it, you're not preaching at them, you're there to help them.
I think what I'd kind of title that is something we do is almost, you've got to find the hook, haven't you?
Yes.
So they might be there for the mental well-being of the current thing, but actually if their hook is sleep is a big part of this right now, then you can focus on, well, actually, loads of evidence that I can share with you now talks about the benefit of sleep just by doing that 10-minute walk a day. It's massive. Or, or confidence. Well, actually, there's those hooks that are all subsets of the kind of mental well-being side of things.
Yes.
Kind of feel like they know then you're not treating it as a general chat.
That's it.
On them as a human being with a couple of things specific for them.
That's it. And, sometimes when patients leave, I've written a little list of things that they can do, maybe 3 things, and, we agree on it. So it's, that they're going to start eating more fibre, or they're going to go out for a walk for 20 minutes a day. And so they leave the practice with this list. I say, pop it up on your fridge, and next time, we chat, we'll see how you're doing with that. And that helps. It's a bit like a health prescription.
Yeah, no, absolutely. And I think that's absolutely right. And people, I think, do respond to kind of, we've talked about lots of things. What are the few kind of summary points that I'm going to do? I mean, one of the other things that we've found really interesting as we've spoken with people around trying to find out what would help them to feel more inclined to do a bit more exercise or a bit more activities, to kind of help them to remember what it was that they used to enjoy about being active. Maybe they used to be a walker or a runner, or I used to ride my bike a lot as a kid, or for, Jamie's been retaking up roller skating, and whatever it might be. Most people, not all, but most people have had some sense of positive experience with physical activity in the past, or remember enjoying it. And it might be, play with your kids at the park more rather than just sit at the bench and watch them play, which I have a bad habit of doing recently. Well, not recently. I've not been at the park.
Call him out, everybody. Government law and rules.
But those types of things, I think there's a real power in remembering as well that I do have a positive relationship with activity, and I've been an active person in the past. Can be really positive as well.
Yeah, that's true.
Ken, I could get the sense of you wanting to start to summarise some points, but if it's okay, I'm going to spend just 1 or 2 minutes now showing something that I think might be of value for anybody listening or watching. And I'm going to show it to Emma as well. So I'm going to start sharing my screen. So if people are watching on the video, they can kind of see this live. So Sport England, along with Public Health England, I think it was like last year probably now, launched something that was called Moving Medicine. And this is something that had been worked on with various consultants and GPs in Public Health and Sport England together to start to try and give some support to medical and clinical professionals with regards to just having conversations with people. And I know, Emma, I wrote down one of those points where one of the big challenges around this is time within kind of appointment settings. And what this Moving Medicine thing is a little bit structured around, if you only have 1 minute, here's a conversation that you can have in a minute that could be really helpful for you and that patient. So if you have a few more minutes, here's how you could add into it. And the idea is that this is aimed, like I said, at GPs or those who might just need a bit more confidence with regards to some of the right things to say. So I'm just showing it online now, and it's movingmedicine.ac.uk. And if you click on the prescribing movement one, what I think is really valuable, so firstly, on that page, you saw the dancing GP, which was a little bit of fun. It's quite kind of, it hooks you to look at it more. But I think what's really good about this is it has different subsections that says, actually, you can have a conversation with somebody with depression, and this is what we would tailor that conversation to be. Or you could look at somebody who has cancer, and all of these have been informed a little bit by specialists in this area to say, this is the type of chat you could have. So I'm just going to kind of click on it now. And Emma, I don't know if you've kind of seen this before or you were aware of it.
No.
So I'll just kind of quickly show it now. So here you can say, actually, for depression, here's a chat you could have. And it has a 1 minute conversation, a 5 minute conversation. If you have a few more minutes, and then it also has like an information leaflet for patients. And just the functionality of it and the ease of it seems really, really strong. And I think there might be a bit of a challenge with awareness of this.
Yes, definitely.
I've not spoke to many who have really known about it.
No.
Other than maybe some of them remember seeing the dancing GP GIF. But I think just as you kind of go through it, and here it says, this is the thing you could ask them. Step 1, ask them if they know that people with depression find that moving really helps them. And there's a tiny bit more info to just help you in what way. And I think it's a really simple, effective step-by-step guide that's tailored to try and happen in a short amount of time. but that could just maybe give people a bit of a confidence that the information they're offering is helpful, and it recognises the limitations of things like time. So I think Emma said you've not maybe seen this in the past or kind of and shared in a way. So I think there's something interesting there for Sport England to understand a little bit more about how they're getting this out there. And I will share this with yourself, Emma, and I'll also ask Alison to put it on Twitter for us.
That'd be brilliant, yeah.
Because I do think it's just one of those things where actually, as you said before, knowledge is power and time is limited.
Yeah.
And this tries to kind of help both of those things a little bit in what seems a really easy to use way.
And I like the fact that there's a patient information leaflet, so we can just print that out and give that to the patient with all the important stuff. I love that. Yeah,
and I think it looks like there's been loads of great thought and effort and detail, and it's rare you see something that's got great content and seems to work really nicely functionally, and this seems to do both of those. So I just thought it was worth raising because I said I think awareness of this would be a good thing, specifically for physical activity. So we will share that. We'll put it on Twitter. We'll share it with yourself, Emma, as well. And maybe we'll pick up a conversation with Sport England one time to understand what more LDPs could be doing if they're not already to get this out maybe a little bit more. Because I know quite a lot are working with GPs and GP practice.
I mean, Emma, one question that's really interesting. So this is kind of into our field of work here, but if as a place you wanted to communicate with GPs and share something like this, what are some of the ways that sort of councils or projects or leisure trusts or community partners or even Sport England at large, what are some of the best ways to connect with medical professionals, would you say, in terms of education and sharing?
Yeah, I think on a local level, probably the primary care network, getting in touch with them. And then, you know, the CCG as well, you could get in touch with them. You know, they can email out lots, you know, to lots of GPs. But the problem is that we get lots of emails. Yeah. So, you know, often it's better if we have some sort of learning events to get this across. You know, we always have the Royal College of General Practitioners as well. And so people could contact them. They've got an amazing website full of resources. And I suppose getting in touch with the GP trainers as well, so that we can filter this information out to all the trainee GPs, get them used to using it all.
That's a really good thought in terms of sort of building from the ground up. If it's, you know, if you work through the GP trainers, then over time, if all new GPs were trained in this area, over time you would have, you know, a greater sense of expertise within the profession around movement and physical activity and that kind of lifestyle.
Yeah.
Because it must be challenging. You know, I've thought about and spoken to many GPs who might have been in practice for 20, 30, 40 years. And, you know, you're constantly kind of developing, of course, but you're treating patients all the time, and the space for personal development, as in any profession, is challenging.
Yes.
And probably in your training 20 or 30 years ago, there's probably very, very limited, if any, kind of holistic physical activity and mental well-being sort of training built in. And perhaps that training, as you mentioned, is even limited now. So there's something around kind of building for the future, as well as then trying to connect with those existing pool of GPs within a place.
Yes, definitely.
I think what we've interestingly covered is we've probably got the people, we've probably got the information, the resources. The bit we haven't quite got yet is how we connect it, share it, build the confidence together collectively. And it feels like we do that. We've cracked it, to be honest.
Absolutely, yeah. We just need to connect up, don't we?
And if Dr Emma G posts it on Twitter once, every GP in the country will bite and be connected and a job done.
I don't think so.
100%.
All right. Well, I mean, we've covered loads of good ground there, and we've really enjoyed our conversation with you today, Emma. I think a few of the notes I've jotted down, you know, just again, a massive shout out to all our health professionals who are working within this situation with the pandemic. You know, you touched on the kind of worry and the mental health side for professionals as well as for local people. I think we touched on just really importantly, if you're unwell or if you've got a significant concern about something, you know, contact your GP. They're still there. You might have to speak to them on a bit of a weird video setup, but still they're there to help. And it's really important that people do that. It's better to find out that you're perfectly well than in 6 months find out that you're incredibly unwell.
Oh, totally, yeah.
And then when we chatted about, what we can do moving forwards or how we might change the system, so to speak, we talked about longer consultations. We talked about adjusting the way that training might happen, both pre-qualification but also afterwards. And then we talked about ways GPs can connect more with communities, whether that's community events, whether that's more live videos and social media training, whether that's group chats online or in person. And a real sense of informal education in a variety of settings would make a big difference. And then we talked about physical activity and perhaps how the moving medicine portal might be a really good way of doing that. So covered loads of ground, and thank you so much for joining us, James.
I'm going to jump in with one, sorry, Ken, just to kind of spoil that beautiful little summary bit that you did there. And actually, all of us remembering, the onus isn't just on GPs in that.
Yeah, absolutely.
So all of that, the onus is on everybody to help GPs with some of this stuff, because it's all our collective responsibility to do so.
Yeah.
So I think yes, GPs are vital in this, but actually, like anybody else, without the right support, help, different ideas being offered to them, it's hard for them to do that in isolation. So it's all of our responsibilities to help them out. I
really feel that positive changes are coming. I feel really optimistic about the future for, patient well-being and things like that.
Awesome. Ken, do you want to bring up Emma's success factors?
Oh, yeah, let me see.
And then we realise, oops, we didn't cover any of that. Okay, so Emma, you talked about you like to have had a bit of fun.
Yes, I had that. Thank you very much. I had a giggle.
Good stuff. I think you wanted to be able to get across messages about the importance of well-being. We'll answer on your behalf and think 100%. We heard lots of that throughout this stuff. And hopefully influencing some professionals regarding engagement in communities. And I think Ken's summary points there wraps that up beautifully based on what you'd said. So
brilliant.
I think pat ourselves on the back. Well done, us. Absolutely nailed all of those.
Success.
So I will wrap up, and then as always, we will hand over to Emma for a bit of a final message. But as always, thank you all so much for listening. Thank you to Emma and Ken for making this as fun as it always could have been, always is. If you've enjoyed this, please tell people about it. Please share it. Hit us up on Twitter. Whatever you want to do to get in contact, please do so. But for now, we'll hand you over to Emma for a bit of a final thought.
Oh, thank you very much. My final thought really is about self-care and well-being, and it's very hard at the moment to look after yourself, to find time, especially if you are a carer or if you're a parent. I just want to say that you cannot pour from an empty cup. You really need to make sure that you are looking after yourself, adequate sleep, that you are eating the right sort of things, and that you are being physically active. Because if you don't start looking after yourself, it's going to affect your family and the people who are around you. So you can't pour from an empty cup.